Assalamu alaikum and namaste. I'm Neesha from the 4th year MBBS LUMS Jamshoro. Want to present the topic on scleritis. First, I want to thankful OcularDDtalks who gave me this opportunity and provide this platform. Now, I start the topic. Before I start my topic, first I tell you what is sclera. It is a dense fibrous collagenous structure which comprises the posterior 5/6 of the eye, or the sclera is the white part of the eye that surrounds the cornea. Here in this picture we show this the whitish part that clear shown to you is sclera, and this is cornea. The surrounding part on the cornea is sclera. It consists of 3 layers: episcleral, scleral stroma, and lamina fusca. What is the blood supply of the sclera? Episcleral and choroidal vascular network. What is the nerve supply? Posterior short ciliary nerve and the anterior long ciliary nerve. What is the function of the sclera? Here we see that it forms a protective coat of the eye and provide the rigidity and the shape to the eye, ball and eye. Now I tell about what is the scleritis. Before we discuss about scleritis, here I show you the picture of the scleritis. It is an inflammatory disease of the sclera, or it is a serious inflammatory disease that affect the white outer coating of the eye known as sclera. Here we see that here is a whitish part of sclera, and here is the inflammation of the sclera occur with vasculitis. Inflammation of the blood vessels also occur. This is known as scleritis. Now we see what is the pathology of the scleritis. Pathology, it is an immune mediated vasculitis that inflames and destroys the sclera. It means the inflammation is immune mediated and is commonly associated with underlying systemic infection such as herpes zoster, syphilis, and tuberculosis. This whole paragraph means that there is an inflammation occur, but because why this inflammation occur? Because the T lymphocytes, B cells, all these attacks on sclera and cause inflammation of the sclera, and this inflammation is granulomatous inflammation. Granuloma is formed, and in between granuloma, here granuloma is formed, and in between granuloma there is a giant epithelioid cells, and maybe the inflammation begin in one area or it is spread into the entire segment. It may be localized or diffuse, means involve whole skeletal tissue or one region. Now I came to on the classification. Classification of sclera is on the two types: anterior scleritis and posterior scleritis. Anterior scleritis is of also two types: non-necrotizing and necrotizing. Non-necrotizing is also diffuse and nodular. Necrotizing is with inflammation or without inflammation. Here I show you picture and tell you about what these are things. First, diffuse scleritis. Diffuse scleritis, this picture shows diffuse scleritis. What are the clinical features of diffuse scleritis? And this is a picture of nodular scleritis. And what are the clinical features of this nodular scleritis? We compare both these and tell you about these two structures, these two pictures. First, diffuse scleritis. In this, the pain is mild, whereas in the nodular scleritis, pain is moderate. In the diffuse scleritis, redness involves entire the lobe, entire the sclera. Here we see the inflammation occurs whole sclera, it involves whole sclera. Whereas in nodular sclera, there is only a region is involved. and only red nodule is visible in that region, which cannot be moved. Here, visual, visual impairment occur in 25% of the cases. These both are the part of the anterior scleritis. Now I will show you necrotizing scleritis. These are the non-necrotizing. Necrotizing scleritis is here without inflammation and with inflammation. The pain is initially mild but gradually becomes severe and persistent, and it frequently interferes with the sleep. Deeper vascular, on examination, we see deeper vascular plexus. Here we see deeper vascular plexus is involved. A vascular patch due to vascular distortion and occlusion also seen on examination. Here we see conjunctival ulceration is involved over the scleral necrosis. These are the necrotizing, inflammation and without inflammation. Now I will tell you about posterior scleritis. Posterior scleritis, it is a inflammatory disease of sclera that involve only posterior to the equator. The pain and visual impairment in both these cases, in such cases, posterior scleritis, the main problem or main symptom is pain and visual impairment. Lid, the eyelid text is the eyelid is edematous. Proptosis also occur in these cases. These are the classification of scleritis. Now I come to the clinical features. Clinical feature first is severe pain that involve the eye and the orbit is usually present. The pain, what are the nature and of the pain? It is dull and boring in nature, and it increase. The pain is increased or exacerbated by eye movements. The worsening of pain during eye movement is due to because of the extraocular muscle insert into the sclera. Now I come to the sign. Sign scleritis present with a characteristic violet bluish. Here we see when we examine the sclera, we see a violet bluish with a scleral edema and dilation. Other sign is the others on the signs we see scleritis location and the degree of the involvement. In anterior segment, there may be a associated keratitis with corneal infiltrates or thinning, uveitis and trabeculitis. Now we come on investigation. On investigation, we do CBC, ESR, urine analysis, circulating immune complex because of inflammation, serological test. In serological test, we may do RA factor, ANA, anti-DS DNA antibody, or ANCA, ANCA, or do uric acid test also. These all tests give us clue about the scleritis. Now we come on treatment. Treatment is we use NCRs, corticosteroid, immunosuppressive, and subconjunctival steroid injection. NCRs is a first-line agent for mild to moderate scleritis. Corticosteroid is used to reduce the ocular inflammation, but the treatment is generally systematic. We may use immunosuppressive if the steroid is resistant, and we use subconjunctival steroid injection such as triamcinolone acetonide is effective in anterior non-necrotizing scleritis and necrotizing scleritis. I hope you understand the topic of whole scleritis. Thank you for listening me.